Yes, hi, I'm Dr. Suzanne Topalian. I'm a professor of surgery and oncology at Johns Hopkins University in Baltimore in the United States. I am the Bloomberg Kimmel Professor for Cancer Immunotherapy in the Kimmel Cancer Center at Johns Hopkins. At the COSMO meeting this year, I'm going to be talking about mechanism-based markers for anti-PD-1 cancer immunotherapy. This is a very important topic in our field right now. As you may know, anti-PD-1 or anti-PD-L1 drugs have been approved to treat 20 different kinds of cancer by the US Food and Drug Administration. And in our country, we now have 7 different drugs, antibodies that block either PD-1, an immune inhibitory receptor on T cells, or they block PD-L1, the ligand for PD-1, which is expressed by tumor cells. But there's a wide range of the proportion of patients with these different cancer types who can respond to these drugs. So many patients still do not benefit from this form of cancer immunotherapy. And our field has paid a lot of attention now and has focused on finding biomarkers in the pre-treatment tumor that will help us identify tumors that are most likely to respond to these treatments. So our group at Johns Hopkins was involved in developing some of the biomarkers for anti-PD-1 treatment that are currently approved for use in the United States. We were first to publish on the use of PD-L1 immunohistochemistry in pre-treatment tumors. In certain cancer types, this does help to find groups of patients who are likely to respond to anti-PD-1 therapy. We were also first to discuss microsatellite instability or defects in DNA mismatch repair that occur in some cancers and are associated with a higher likelihood of response to anti-PD-1 therapy. So now we are turning our attention to the next generation of biomarkers, and they may not be single markers such as the ones that are already in clinical use. So we feel that by using sophisticated methods in bioinformatics, we should be able to combine multiple markers into one model that will help us to predict even better which patients are most likely to respond. So this is really the future of biomarker work for anti-PD-1. We are also focusing on a treatment strategy called neoadjuvant immunotherapy, where we use immunotherapies such as anti-PD-1 before the patient has surgery. This is used in patients who are at high risk of relapse after standard cancer surgery. Well, the focus of my work is on immune checkpoint blockade. And so the PD-1 pathway is just one of the checkpoint pathways that inhibit anti-tumor immune responses. And so we know now that by blocking that pathway, which appears to be a dominant immunosuppressive pathway within the tumor, we can mediate the regression of early cancers as well as very advanced cancers. The future, I think, for our field is to continue to look at other checkpoint or co-stimulatory pathways that can be modulated by drugs. Now we have drugs that block 3 different checkpoint pathways, the first being CTLA-4, which I did not talk about earlier, and the second being PD-1, and most recently the LAG-3 pathway. So that's part of the future. The other part of it is to use these treatments at earlier points in time before the tumor becomes advanced metastatic stage 4. and to develop combination therapies based on a deeper knowledge of how all of these different pathways modulating anti-tumor immunity interact. Yeah, it's my great honor to be included as a plenary speaker in the COSMO annual meeting. I know that the audience includes people in all different aspects of cancer care and cancer research, as well as young investigators who are just starting their careers in this area, and that it spans many different countries around the world. And so I would like to thank all of these stakeholders for joining the meeting, for coming to learn about cancer immunotherapy and other forms of cancer therapy. And I hope it will be a meaningful experience for all of the participants.